My name is David Kernick. I'm a general practitioner in Exeter, where I run a headache clinic for NHS Devon. I'm also the clinical lead for the Royal College of General Practitioners in Headache here in London. And I'm very pleased to have with me today Professor Anne Macgregor, who is the clinical lead at the City of London Migraine Clinic, and Alison Frith, who is the headache nurse at the clinic. The aim of a series of our discussions is to give you a little more understanding of migraine and hopefully a little bit more control over your problem. I guess I have to say from the start that this is unscripted and unrehearsed, and we're not going to edit it, so if we do not go quite according to plan, I hope you'll forgive us. In this first video, we're just going to look a little bit at the background to migraine. And Alison, I wonder if I could start with you by really saying there is no cure for migraine. Is that correct?
That's true. Many people think that they will have a cure for migraine and are often very disappointed when we tell them that migraine is a chronic condition, and one of the ways that they have to cope with it really is to learn to live with it, but that there is a lot to be done, that they can actually feel a lot better by finding out more about it and accessing treatments and care.
Right, so I guess the aim of our care is to give them a little bit more control over their problems. A lot of people I see in clinics, certainly their lives are out of control with their migraine, so we try and shift this locus of control to giving them a bit more understanding and control.
Very much so.
Is that your aim of management as well?
That's right.
Yeah. And I wonder if you could just start off by saying a little bit about how many people get migraine and the impact upon the quality of their lives.
I think it's very true to say that migraine is underdiagnosed. Studies in the UK have suggested that overall about 1 in 7 people get migraine. But if we look at it, breaking it down into sex differences, it's about 1 in 5 men and about 1 in 5 women and about 1 in 13 men. But that's looking at it overall. So if you're taking a population as a whole and you're saying, let's see how many people have migraine at any one time, those are the sorts of figures that come out from the studies. When you look at it much more as a lifetime potential, we know that it's going to be potentially about 40% of women and about 20% of men who might experience migraine at some point in their lives. So actually a much larger figure.
So it's a very big number.
So it's a big number, and I think we'll come on to how migraine is a misdiagnosis probably as we talk a little bit later. Disability, that's a difficult one because people who don't have migraine really do not recognise what those who do have migraine are experiencing. And now that the WHO, the World Health Organization, have recognised migraine as being the 12th most leading condition of years of life lived with a disability in women, and 19th overall, then I think we can start putting a bit more weight on what people are really experiencing. But lives can be wrecked. We have patients who say, you know, I had to change my job because I can't do full-time employment, I have to do part-time work around my migraine, or marriages that have fallen apart because, you know, the level of need that somebody with migraine may have is just more than a marriage can take. And
there are also broader economic consequences as well. People lose work, they're not efficient or effective at work.
That is the other, I think, unrecognised problem as well, that I think that people don't own up to having migraine. We know from occupational health departments, for example, that they will dispute that migraine is even a problem in their work, in their business. We know that's not true because we know from the people within the working environment that a large proportion of them are not able to say to their occupational health department that they have migraine because they perceive there to be some kind of stigma or lack of recognition of the severity of the problem.
Yet it's been estimated to cost the economy about 2.5 billion a year. That's a lot of money.
It's a lot of money. I think, again, that is an underestimated cost. That if you actually take the true disability, the true loss to the economy, the true cost that patients with migraine are covering themselves by self-treating, then it's actually going to be much higher cost.
We mustn't forget children. We did some studies in Exeter. We looked at school teenagers, and we reckoned about 20% of them had an impact upon their quality of life through headache. And for 10% of all school children, that impact was really quite significant, with quite big quality of life impact scores. So it affects both children, particularly in their teenage years, as well as adults, and I think that's something that's very largely overlooked.
And if we could improve the management and enable children to better manage their migraine, I think that would reduce disability in later life as well.
I mean, one of the things that interests me is, despite this huge impact, less than 50% of people have ever gone to see their GP and sought help. Alison, I wonder why you think this might be. Why are people reluctant to seek help for their headache and their migraine?
I
think many times when people go to see their doctors, it's perceived as just a headache that isn't going to kill you, and it isn't taken terribly seriously by doctors. But people with migraine very often try to cope on their own, buying over-the-counter medications. They're embarrassed by talking about it and seeking help in the first place.
Right, and it's one of these things that you're free of pain in between attacks. I think that the feeling is it's not going to come back again. I don't know if that's a sort of...
Migraine is a recurring disorder, and people do try to forget about it in between attacks, although they can live in dread of the next attack. And
the other problem, of course, you can't measure it. There's no blood test or x-ray like other things in medicine that you can sort of put a number on or put a handle on.
That's right. People often think that they could have a blood test that would show migraine, or that they could have a brain scan that would indicate migraine, but there are no tests that doctors can do that can say definitively that you have a migraine attack. Okay, well, thank you. That's by way of a brief background. I think what we're going to do in the next discussion is move on to how we might make the diagnosis and what other types of headache exist and what other things we might like to look out for. Thank you.